Hello, I am Dyslexo Boy. This series is about practical advice on how to overcome dyslexia and ADHD while studying in med school. In this video, I'll be talking about approaches and attitudes towards exams, specifically covering why you should not use exams as a barometer for success, especially for people with dyslexia and ADHD, as well as skills for sitting single best answer style exams. Let's get started by talking about how limiting exams are in their ability to assess a person. The majority of tests you will encounter are standardized, meaning they have been designed to be administered and marked in a consistent manner. In other words, it's a one-size-fits-all format. This is problematic because humans exist on a bell curve in almost every respect. While standardized exams may be suitable for the majority of people, there will always be those who fall outside of their purview simply because of the variety present in nature. As a comparison, this is a bit like if we assessed a person's health and fitness by asking them to fit into an average size pair of trousers. Because they're average in size, the majority of people would be able to fit into them, but there will also be some who can adjust the requirements by wearing a belt or sucking in their stomach. Anyone who is too big for the trousers is deemed to be overweight, and anyone who is too thin to keep them up is considered underweight. However, they've neglected to adjust for things like height, waist to hip ratio, or lean body mass in this example. People who are extremely tall or short, to take one example, will not fit into the average trousers despite being a healthy weight. Those of us with dyslexia and ADHD are synonymous with the people who are too tall or too short. We interpret information differently, and that means it's difficult to test us in a standardized way. The exams that work for the average person don't accurately assess us because we have different factors that affect the result but aren't accounted for. There are ways to compensate for our dyslexia while taking exams, which I'll talk about in the next video, on reasonable adjustments and how to use them. But for now, I want to focus on the skills of answering an exam question. Part of the reason written exams are so difficult for people with dyslexia is due to the format in which they're delivered. Most exam questions are complex word games. Single best answer questions are basically riddles. You're provided with a paragraph of text full of clues and expected to deduce the correct answer out of 5. Essays expect you to understand how to correctly synthesize and format an argument, and short answer questions require you to condense complex ideas into a single sentence. All of these are made more difficult if you struggle with a text-based format. I don't want to make it sound like revision is unimportant. That's not true. External knowledge and context will help you deduce and reason out correct answers. However, interpreting and answering exam questions is a skill in itself that needs to be learned. In fact, in England, private schools focus on teaching exam technique far more than public schools, or so I've been told. They understand that it's a key ingredient for success. This is why during your revision time, just before the exam, you need to be practicing exam questions. It's important to familiarise yourself with their format and see the pitfalls and challenges they each present. The current vogue in medical school exams, and for the GAMSAT as well, are single best answer questions, or SBAs. These are composed of a STEM, which is usually a scenario involving a patient, a question based on that text, and 4 or 5 answers to choose from. While this sounds like a simple multiple choice question, it's not. There are potentially more than one correct answers within the options that you're given, and you've got to find the one that is the most correct. This is a nightmare for people with dyslexia because the difference between answers often comes down to grammar rather than anything else. Often a single word can change the emphasis of an answer, which is difficult if your dyslexia makes you unconsciously skip parts of sentences. Alternatively, there can be an overabundance of irrelevant information. This is an overload for your short-term memory and can make you miss key points when you're trying to figure out the answer. Ooh, that's my phone. Another common question type is where all the answers are the same, except for one or two words which are switched out for each. This drastically changes the meaning, but it can sometimes feel like you're trying to translate a different language. In order to give yourself the best chance of success, you need to be aware of strategies to help you discern the correct answer in these situations. First, read the question aloud. I often accidentally miss parts while reading, as I mentioned before, and missing a single word can dramatically change the question being asked. Reading the question out loud takes slightly longer, but will ensure you read every word that is written down. I often also read the question before the stem. This might seem counterintuitive, but think about it like this. Taking a history from a patient is not an academic exercise. You're always trying to figure out the answer to a clinical question. Reading the question beforehand allows you to focus on, and highlight if you have that adjustment, what specific information you should be looking for. Sometimes the question will have absolutely nothing to do with the stem, and you will have saved yourself time by simply not reading it altogether. When you've finished reading, check if the question is inclusive or exclusive. Are you looking for the correct answer to the question? Which of these examples is a symptom of heart failure? Alternatively, are you being asked to find the odd one out? Which of these examples is not a symptom of heart failure? You noticed how the questions I used as examples just now were the same except for a single word. This can be easily missed, especially if you're rushed or stressed. Make sure you read the whole question and all of the answers. This is important because the nature of single best answers, there's always the potential for more than one correct answer. I've made snap judgments in the past without properly reading all of the options and have missed the more correct answer further down the list. In my experience, there is usually one answer that is absolutely wrong, and it's usually the opposite to the correct answer. Then there will be two answers which are frequently made mistakes, and a further two answers which are correct, one of which will be the more correct answer. Red flags to look out for are things like definite answers. So words like always or never, these are usually false. Things are rarely so definite in science, so with some exceptions, these can be safely eliminated. Sometimes, and especially in questions about drugs, they'll include an answer which is spelt similarly to the correct option, but is a completely different mechanism. For example, if you're being asked what medication is appropriate for hypertension, they may include something like amiodarone if the correct answer is amlodipine. Look for answers which are diametrically opposed. For example, if the options include vasoconstriction and vasodilation, there's a good chance that it'll be one of these two. Eliminate any answers you know to be wrong by crossing them out. Remembering that an answer is no longer relevant takes up space in your short-term memory. Indicating that it is wrong frees up that space. Crossing it out somehow stops the words from creating interference for me, resulting in the remaining answers being easier to read. If you're taking an exam on a computer, most will have the ability to let you cross out options you've dismissed, so make sure you're familiar with how to do that. Finally, if you don't do the exam in order, then that's fine. In my experience, whoever writes exams loves putting the most difficult questions right at the beginning, just to stress out students. The first thing you should do is find a question you can do and start working from there. Bookmark any questions you haven't already done. This is completed automatically by the computer most of the time, and return to them at the end. It's important to build up confidence when you're taking an exam, as you're more likely to be thinking clearly and answering questions correctly. In contrast, if you're stressed, you're more likely to make a mistake. This is not a comprehensive list of techniques for dealing with exam questions. It's simply the ones that have helped me. There are lots of excellent lectures, courses, and YouTube videos about strategies for interpreting and answering different styles of exam questions. I'd recommend you look through some and find techniques I've missed and which might suit you better. In my next video, we'll be talking about reasonable adjustments and how to use them. Thank you for your time.